Using the ULTRAPREP sleeve in the preoperative patient holding area. Preparing and pouring liquid medication into the ULTRAPREP sleeve. Open the kit. Remove, unfold, and place the large absorbent pad under the patient's buttocks and leg, or shoulder and arm, with the patient recumbent in bed. Open the sealed bag containing the ULTRAPREP sleeve. Securely attach the supplied short clear tubing to the sleeve port and close the clamp. Pinch and slide your fingers down both sleeve zippers, ensuring they are closed. Remove the red cap from the drain bottle and cut the spout above the first notch. Reattach the cap and set the bottle aside. Place the ULTRAPREP sleeve on the foot of the bed between patient's legs for lower extremities or at patient's side for upper extremities. With the zipper facing medially, open and raise the blue sleeve cuff a few inches from the bed to receive liquid medication and to avoid spills. Pour the prescribed liquid medication into the ULTRAPREP sleeve through its blue cuff opening, allowing the liquid to pool at its distal end in preparation for the sleeve application. Applying ULTRAPREP on an extremity. While keeping the zipper oriented medially, slide ULTRAPREP up to the calf or mid-forearm, then pull the entire sleeve past the heel or wrist like a large stocking. Continue to slide the sleeve proximally above the knee or elbow using your fingers grasped and rolled under the blue cuff. Prepping limbs with liquid medications. Fashion the pre-folded blue towel into a tight roll and place it between the blue rubber cuff and skin on the anterior surface of the arm or leg. Starting at the foot or hand, gently squeeze the sleeve against the extremity while sliding your hands toward the proximal sleeve end to remove excess air in the sleeve. When your hands reach the proximal end of the sleeve, pull the blue towel out from under the blue rubber cuff. Repeat this procedure as needed to remove the maximum amount of air possible within ULTRAPREP. Manipulating liquid medication. Start by flexing the knee or elbow, allowing the antiseptic to pool at the distal end near the foot or hand. Massage the liquid thoroughly onto the foot or hand and pinch between the toes or fingers. Once the distal extremity is thoroughly covered, gently straighten the sleeve and lightly lift the extremity, allowing liquid to pool proximally. With the antiseptic pooled at the proximal end, cup your hands under the extremity sides and slide the liquid to the anterior surface of the leg or arm. Thoroughly cover the entire limb with antiseptic multiple times using this method. If a patient is able, encourage them to participate in the prep by wiggling their toes or fingers for optimum antiseptic distribution. Thoroughly spread and scrub the liquid onto the entire skin surface for at least 3 minutes using this method. Removing liquids from ULTRAPREP in the preoperative patient holding area. For lower extremities, gently straighten the sleeve to facilitate the flow of the liquid toward the distal end. Placing the bed in a slight reverse Trendelenburg position will help. For upper extremities, simply lower the patient's arm. With the liquid pooled at the distal end of the sleeve, ask the patient to slowly bend their knee or arm if they are able, so that the medication stays at the distal portion of the sleeve. At this point, the patient may feel a temporary tightening of the proximal cuff when their leg or arm is bent. Orient the drain tubing to the bottom of the sleeve. Securely push and attach the tapered bottle tip to the tubing and open the tubing clamp. Squeeze the attached bottle multiple times to remove as much liquid as possible into the drain bottle and then close the clamp. Remove and cap the bottle, then dispose the bottle with its liquid contents according to hospital policy. Removing the ULTRAPREP sleeve in the OR. Prior to opening ULTRAPREP and with the zipper positioned medially, slide the leg or arm inside the sleeve to the side opposite of the zipper. This is done so that the extremity will be in the central part of the sleeve once it is opened, lessening the chance of contamination. With the extremity straight on the bed or arm board, tear away and discard the 2 perforated tamper seals from the sleeve. Slowly pull apart the strongly sealed blue tape tabs at a 45-degree angle, and open the Ziploc only at the corner under the blue tape. Touch a small portion of the blue tabs back together to form a partial tab adhesive reclosure. Starting with distal short side of the sleeve, open the Ziploc just enough to disengage that zipper while leaving the short sleeve flap closed to minimize the chance of contamination. Continue opening the long Ziploc from the distal to the proximal end of the sleeve. Upon reaching the blue cuff, tear or cut completely through the cuff at the proximal end of the sleeve. Open the partially reclosed tab and grasp the sleeve at the proximal and distal end. Then unfold the device toward yourself, exposing prepped limb. If liquid medication contains alcohol, wait the required time for the antiseptic and alcohol solution to dry, then drape the patient per standard hospital protocols. The extremity is prepped and ready for the medical procedure.